Good afternoon, everybody. I'm here with my colleague, Senator Richard Burr, where for 2 years we have worked on the reauthorization of the Child Care Development Block Grant. I'm pleased to say that today we've overcome the cloture hurdle and we will be on our way to moving the Child Care Development Block Grant bill to the Senate floor for the first time since 1996. This is an important bill because it meets the compelling human need of many of our families. Families who want to work but need to find child care that is accessible, affordable, safe, and reliable. Now, the Child Care Development Block Grant Program is the primary source of funding for child care assistance by the federal government. States administering a program help low-income families gain access to child care that is affordable, has quality to it, and safety to it. What it is a voucher program that in this country serves 1.6 million children every single month. We have been working together on a bipartisan basis, reaching across the dome with the House. Senator Burr and I teamed up in the Health Education Committee. This shows that when we work together, we can really get great things done. It's not about the reauthorization. It's about, in a technical sense, it's about the fact that we know in our families, whether it's in Maryland or whether it's in North Carolina or throughout our country, child care is one of the biggest challenges that families face. In order for it to be available, in order for it to be safe, in order that it provide not the warehousing of children, but a path that leads for them to be school ready. Child care is also expensive. In many communities, child care can cost as much as $15,000 to $20,000 a year, almost the same tuition as going to a private prep school. This is the fact that we need to be able to help provide a federal subsidy to be able to enable people who want to work be able to get to work. Now, Senator Burr and I teamed up, and one of the first things that we said is that child care needs to be safe. We were sure to require comprehensive background checks. This was to be mandatory. Currently, only 13 states require background checks, and now it will be all 50. Second, we wanted to strengthen health and safety standards. Child care will be required to be sure that everybody working in child care knows first aid, CPR, how to deal with sudden infant death syndrome, and to be ready for any type of emergency. For example, what are you going to do if you're a child care provider and the tornado warning goes off? People will be trained for those who are caregivers. The other is that we wanted to improve quality, to be sure that the children have the right people with the right training to not only care for them, but to make sure that they were learning and school ready. At the same time, we did not want to have regulation that led to strangulation. In other words, pushing out the small child care provider. We were able, by working together in a common sense way, listening to people with experience from the child care community, as well as states who administer the program, as well as both faith-based and private sector entrepreneurs. By listening to the people, listening to parents, and listening to each other, we're going to bring a bill forward that everybody said could not be done. Well, we showed that it could be done, and I want to thank Senator Burr for his wise counsel, and also Senator Alexander, who provided great help, and Senator Harkin. But it is our hope and our plan that we will vote on final passage on Monday. I'd like for you now to hear from my colleague, Senator Burr.
Barbara, thank you. That's okay. Leave it there.
You don't need that.
No, but Barbara, 96-1 on the cloture vote, so I think Monday is a formality as to whether this passes and becomes law. And why is this so significant? The child care credits were passed the second year that I was in Congress, 18 years ago, 1996. And for the first time, we're going back and revisiting, actually doing the reauthorization. Sure, these grants have been in place, these credits have been in place, but the world's changed a lot in 18 years. And I think that's what Barbara and I have tried to highlight, that there's safety and there's quality standards that could not be placed into this federal program without a reauthorization. So 3 years ago, we sat down separately with families from Maryland, families from North Carolina. We heard what their concerns were about. And then we came together and we started working on legislation. Nobody can accuse us of expediting this to the floor. This is 3 years in the process to do what some would consider to be a simple reauthorization. But as Barbara has pointed out, what we've done is we've instituted levels of safety and quality that people have talked about and never accomplished. 13 states, now 50 states, will require background checks for anybody who works in child care where there's a federal credit that goes in. This is incredible security for those parents of those children. Roughly 1.6 million children, 74,000 of them who are going to be in North Carolina. And that parent will know not only are they trained for the emergency services needs that that child might have, but that the people that take care of their children will have passed a background check saying they're not felons, they're not child abusers. And I think the reason that we're here today is because what we proposed made common sense. We reached out to every group that was willing to engage us, and I think that the final draft, as is evidenced with today's vote and I think Monday's vote, it has no opposition. It's been embraced by every stakeholder around, but more importantly, by every family who's got children that will be in this system. So let me also reiterate my thanks to Barbara Mikulski. She is the greatest partner one can have. She is one of the most tenacious individuals I know in the United States Senate. If you're going to take on something tough, she's the partner that you want. And I just feel fortunate that she was willing to work with me and to include me in this. But special thanks goes to Senator Harkin, who will be departing in a little over a month, and Senator Alexander, because without the support of the chairman and the ranking member, we'd have never got this out of committee. A lot of folks said, as Barbara pointed out, this is nice, but it can't be done. Well, we're going to do it. We're going to do it with no opposition, with no amendments, because we did our homework and we took the time that it takes to put together a good bill. Thank you, Barbara.
We'll now be happy to take any questions. Yes.
I know Senator Harkin in his labor age appropriations bill has proposed adding some more money for this to pay for the new quality programs. Is that something that you're looking to do?
Well, as you know, we're working on the omnibus and reconciling it, but let me just go to what we did in fiscal 14. The Child Care Development Block Grant Program was funded at $2.36 billion. We increased it by $154 million above fiscal year 2003. Now, as we're working on the omnibus, we hope again to have a steady increase. But as you know, the House has a much lower number in labor HHS. But one thing we do agree, this bill will be a big help. To be able to sit in conference and negotiate on the money and say that we've achieved an authorizing legislation that has strong bipartisan support with well-known, staunch Republican senators, we think that we'll be able to get modest increases, and we think the authorization will enable us to do that.
I'm sorry, you said you were working on this, but can I ask you about President's executive orders?
I'm not aware of the President's executive order.
Executive orders as far as immigration is concerned.
I've only know what rumors I've heard. I'm sorry, I can't comment.
Okay.
Any other questions on the child care bill? And actually, where there's been truly a successful effort at bipartisanship, where literally two people who care about, one, the needs in our state, to be able to move people from welfare to work, that in order to, that if you want to work, we want to make sure you're able to do it, who work together across the aisle to make sure that we know that often the lack of affordable childcare holds mothers back. Also know that the quality of childcare has a lasting impact on children. We knew we couldn't get large sums of new money, but what we did want to be is to make sure that the childcare that was going to be available was going to provide real care. Senator Burr is well known for his advocacy for vulnerable populations. When we were working on the census together, we wanted to be sure that any government worker that was going to come in to a home where there was an elderly person or a fragile child with a significant intellectual disability challenge would not have to fear who was coming into their home. When government subsidized child care, we want to be sure that when a mother and father walks that child over the threshold, that child's going to be safe. Then we also knew that child care was not to be about warehousing. It's not just plop a kid down, give them Play-Doh, TV set, and a high sugar drink. We wanted to be sure that their physical needs, their intellectual needs, and their nutritional needs were met, but not in a way that pushed out the faith-based providers. I think we did a great job. We listened to over 300 stakeholders. Everybody had an opinion, and then they had opinions about opinions, and it was our opinion that they needed to be heard. So this is really what we think, not only what we've done for children, but we think this is a model for the way the Senate can work together, starting with civility, identifying the common need, identifying common ground that we could work on, ironing out differences, and coming to what Colin Powell calls that sensible center. I'm really proud of the bill, and I'm proud of the process by which we arrived at the bill and the people involved. So having said that, thank you.
Thanks.